As we all know, since March 2020, life hasn't been normal for anyone. However, thanks to our supporters, Asthma UK and the British Lung Foundation have managed to be there for people with asthma and other respiratory conditions when they needed us most.
In January 2020, calls to the charity's helpline were normal for that time of year, despite news from the World Health Organization that a coronavirus was breaking out in China.
When the UK first went into lockdown, guidelines were changing rapidly and some people's lung conditions were asked to shield. As the UK's leading lung health charity, we made sure that we understood the guidelines by speaking frequently with the government officials, chief medical officers and NHS leaders to ensure we provided up-to-date information for people with lung disease to keep them safe.
The data was kept up to date on the website so that I could always refer to it if I needed to.
A lot of the question and answer sessions on YouTube as well, really so valuable.
Some people might develop breathlessness after a few days, and I think if people start to get breathless, it's really important that they contact the NHS to make sure they get an assessment.
Early in the pandemic, we recognised that COVID-19 could have long-term health effects. This is why we launched the Post-COVID Hub as a resource for healthcare professionals and people living with the longer-term effects of COVID-19.
I tried wearing various masks and found a few of them, I felt like I couldn't breathe in them.
That's why we were the first to launch a downloadable face mask exemption card.
We funded research into COVID-19, contributing £500,000 to projects that have improved diagnosis and also helped us gain a better understanding of how coronavirus affects people with lung disease.
Callers were so grateful to be able to get through to us on the helpline for help and advice, as they were finding it incredibly hard to get to speak to their GP or get through to 111.
Basic healthcare services for people with lung disease were simply unavailable. We gathered evidence on the delays to care and launched a report calling on the NHS to put a plan in place to make sure people with lung disease get the appointments and tests that they need to keep them well.
The highest point throughout this pandemic was when I was able to get my COVID vaccine.
I don't think that I have deconditioned yet. I'm still finding it all a bit strange.
With all the restrictions now lifted, we do understand that people with lung conditions are still worried. We will continue to be there for them all.
I do want to say a big thank you to everyone at Asthma UK and BLF for working so hard on our behalf during a pandemic that was ever changing and still is ever changing.
But the truth is, we couldn't have done any of this without your generous support. So thank you.
Thank you.
Thank you.
Thank you.